All right, for my informative essay, I'm going to talk to you guys about doing something we do here frequently at work in the ER with our patients called central venous pressures, or CVPs. These are done to monitor fluid input when these animals are really sick, and we want to make sure that we're not sending them what's called fluid overload, where their heart can't handle as much fluid as we're putting into them to help make them feel better. We can see these in patients who have severe kidney disease, who are severely dehydrated. So this is just something we'll do to monitor proper patient care, to make sure that they're doing okay with what the fluids are trying to help them make feel better. With this procedure, we place what's called a central line, which is a catheter into their jugular vein, and we note the placement of it, which is outside the right atrium of the heart, on an x-ray. So, and usually they're mildly sedated for this, so that's more comfortable for them. This is a measurement of the hydrostolic pressure within the thoracic vena cava, which is the big vessel that runs through the center of your body. That is a source from Dr. Hackett. There's a little bit of a setup for this procedure. It's not considered a sterile procedure, but it's considered a clean procedure where we wear gloves to protect ourselves, and I have a fake patient to show you how to do it. It's important to be very consistent with doing CVPs because we want to see a trend. That's the point of these. Is there's values that tell us what is normal, what is abnormal, and how the patient's doing and how they're tolerating it. Normal for a dog is 5 to 10 centimeters of water, and cats is 2 to 5 centimeters for water, and that's also from Dr. Hackett as well. With most procedures that we do here as technicians, there can be wrong ways of doing this. Some of the issues that we have with CVPs is the placement of that central line in the jugular, and we want to make sure that it's well placed, it's working properly, and that, again, on the x-ray, we can see that it's where it's supposed to be and it's comfortable for the patient. This only tells us if the animal is in right-sided heart failure, which means that fluid is backing up into the chest cavity instead of into the abdominal cavity. So if they're in left-sided heart failure as a result of fluid, it doesn't tell us that. It only tells us one thing. So it can be a little accurate about that. And they also have clotting issues, like if their platelets aren't working, it can be inaccurate. It can also, if they have any immune-mediated diseases, or head trauma can affect the CVP results as well. And that's from Dr. Silverstein and Hopper. If a patient has a low number of CVP that's outside the 5 to 10, or in dogs, and 2 to 5 centimeters in cats, it can tell us that they're missing a lot of fluids, that they've been severely dehydrated, that we are trying to rehydrate them, and then we have a little bit of way to go before we have to worry about fluid overload. Like I said, this is a pretty common practice in the emergency room. We usually do this when the animal is critical or has a very severe disease process happening, and we just want to monitor them closely. It's a pretty simple process, but it tells us a lot, and us meaning the doctors. The doctors really like to know these numbers. You need a special kit, which they make, and I have the kit here. So this is a manometer, which has centimeters on it. Don't mind the red fluid. That's just for example. We do not put red fluid. This would be sterile IV fluid that the patient is on that we would be putting into the system to monitor. It's kind of hard to see, but there is a little red ball at the top of this, and that is where we would mark our reading. And the number fluctuates because it's going into the heart, so it beats accordingly. We have a syringe, which we use to prime the manometer, and we prime the line that goes to the patient. We have to prime it with fluid beforehand because air cannot go into the central line that's in their jugular, which is right outside their heart. Air can be very bad for them. Again, this is red for example purposes. I'm going to use a stuffed animal to show you how it's done. And like I said, I'm wearing gloves for protection. And basically, I'll show you my patient. This is my dog. Usually when we place a central line, we'll use vet wrap or a type of wrapping cast material to protect it and to keep it clean and to keep it from getting scratched or pulled out. There is a T-set here, which is a port that leads into the catheter, that leads into the patient, just as an extra, adjustment. Give it some wiggle room if there's a lot of movement, so it's not directly connected. So if the line were to come disconnected, it's not coming straight from the catheter, it's coming straight from this extension here. This gets fed into the patient, and then it's in their jugular, which is right outside the right atrium of the heart. So basically what we would do is, let me adjust here. We would have our patient, and usually they're either in what's called sternal recumbency or lateral recumbency, depending on what's comfortable for the patient. But again, you would do it consistently to, you would have them positioned consistently every time to keep with having accurate CVP results. So for this example, I'm going to have him in this is sternal recumbency. That means he's laying on his chest. Lateral recumbency would mean he'd be laying on his side. So for this, sternal is best. All I'm going to do, I've primed my system here, and I'm just going to remove the cap. Again, this is a clean procedure, not a sterile procedure. And I'm going to attach it to my patient. The other important thing to note with CVPs is that this remains sturdy. So once I set it at a point that this is where things have to keep consistent, because if it's up high and you're trying to get a reading, it's going to be inaccurate. And if it's lower than the patient, it's going to be inaccurate as well. So again, consistency. So sometimes making notes or, having a protocol set when it's doing these is ideal to keep those numbers accurate. So all I'm going to do is my manometer is primed, my line is primed, and I have extra fluid. I'm going to turn the stopcock that's built into the system. I'm going to turn it off to the syringe. So as you can see, fluid's flowing through. And for this example, it's not going to flow back. So if I were to have a result, it would be stuck. The little ball would be at a number once the fluid got filled to where it needed to go. And that would be our CVP results. And again, the doctor takes this information and creates a trend. And if we know it's trending high, we have too much fluid in the animal and we have to decrease the fluid, we have to stop fluids or come up with another means of them receiving fluids that isn't so detrimental on their system, but still to be able to flush any of the potential disease processes what's going on here. So again, where the ball ends up is where our number is, and we would do this 3 to 5 times initially just to start a trend, and then depending on how frequent we were doing it, depending on what the doctor wanted, we would continue it every hour, every 2 hours, every 4 hours, just again what was indicated. So yeah, that's what we do here in the ER with our patients. Thank you.